Medicare. Traditionally, that is like starting in 1965 and not changing. We have focused on one side to try to keep spending in check, and that is on the providers and how we pay providers. That has been historically what we have done in Medicare. Typically, when we have wanted to slow spending, we whack the amounts that we reimburse providers, clinicians, institutions, home care, nursing homes. Occasionally, we move to try to have the spending occur in a slightly smarter way. And that was reflected when we moved to a per-discharge payment for hospitals, for an episode payment, for home care, for outpatient in a bundled payment. Unfortunately, we have seemed unable to make that move for the current leaders of the healthcare team, the physicians. Still pay them in the most disaggregated way imaginable. And in the Affordable Care Act, while there are little seedlings being planted that provide the hope for something smarter in the future, it's important for people to understand what we have now in law for the rest of the decade is basically the same dysfunctional reimbursement system under Medicare we have had all along, which is you get more income for providing more and more complex services. Little tweaks are starting. Value-based reimbursement for hospitals this year, starting in 2015, a value modifier for physicians, extended to all physicians in 2017. I think they're perfectly fine ideas. They're tweaking the tail of the distribution and ought to be expected to produce about as much change as tweaking the tail of the distribution would, in your imagination, provide. Maybe some of the interesting innovations that are being started will lead somewhere, will lead to a different way of reimbursing for services. Our history is not particularly promising in that area, but we'll see what happens. We need to understand that because while we like to talk about the different world, and it is in the private sector actually beginning to occur more rapidly, not as rapidly as it needs to, but more rapidly because there's no mother may I that's required in terms of how you change reimbursement. In Medicare, we are basically still stuck with the same dysfunctional system that we have had in the past.